In a bustling metropolitan hospital, Sarah, a new phlebotomy student, shadows a seasoned phlebotomist named Mr. Ramirez. He explains that phlebotomists are healthcare professionals specializing in drawing blood for diagnostic laboratory testing, transfusions, research, and donations. Their role encompasses patient identification, specimen collection, handling, and safety, forming the crucial link between patient care and laboratory analysis. Motivation, precision, communication, and compassion are Mr. Ramirez's guiding principles. As they walk through the clinical laboratory, a mural depicting the evolution of phlebotomy catches Sarah's eye. Mr. Ramirez points out that centuries ago, bloodletting was a common practice, often performed by barber surgeons wielding leeches and blades. Over time, phlebotomy matured into a science with rigorous safety standards and professional training, reflecting advances in medicine and technology. Sarah observes the lab's operations. Mr. Ramirez explains that clinical laboratories perform vital diagnostic tests, analyze specimens, provide blood products, and support disease management. Accurate laboratory data underpins nearly every medical decision, making the phlebotomist's role indispensable for patient outcomes. They meet personnel in lab coats: clinical laboratory scientists, technicians, pathologists, and phlebotomists. Mr. Ramirez outlines how staffing varies based on the institution's size and complexity. Each professional fulfills distinct duties. Scientists oversee analysis, technicians run assays, pathologists interpret results, and phlebotomists collect the foundation, specimens. In a small conference room, Sarah attends a training session explaining the impact of regulatory amendments. She learns that periodic legislative updates mandate stricter safety, documentation, and competency standards for all laboratory staff, fostering public trust in lab services. A slide presentation highlights the Clinical Laboratory Improvement Amendments, CLI, of 1988. CLI established quality standards for all laboratory testing on humans in the United States. Mr. Ramirez stresses that CLI certification is mandatory and determines requirements based on test complexity, ensuring accuracy, reliability, and timeliness of patient test results. Sarah tours sections of the laboratory: hematology, chemistry, microbiology, immunology, and blood bank. Each department specializes in different tests, requiring unique specimen handling protocols. Phlebotomists must understand which samples are needed for which department and how improper collection can compromise results. Mr. Ramirez describes the range of healthcare organizations: hospitals, clinics, reference labs, and urgent care centers. Sarah learns that each organization has distinct workflows, policies, and patient populations, affecting how phlebotomists perform their duties. On the wall, plaques from the Joint Commission, JC, College of American Pathologists, CAP, and the American Association of Blood Banks, AABB, demonstrate laboratory excellence. Accreditation validates quality, safety, and operational integrity. Sarah reviews forms from federal and state agencies like the Centers for Medicare and Medicaid Services, CMS, and the California Department of Public Health. Mr. Ramirez stresses the importance of meeting these regulatory obligations to avoid penalties and protect patient welfare. In a satellite clinic, Sarah participates in point-of-care (POC) testing. Mr. Ramirez notes the rise of alternate site testing in non-traditional environments: physician offices, mobile units, nursing homes, and remote settings. Quick test results improve care but require strict adherence to standards. Back in the classroom, students discuss medical legal issues: informed consent, patient privacy, specimen labeling, and documentation. Negligence or error can have serious consequences, jeopardizing patient safety and risking litigation.